Well, you know, the medical field is just expanding leaps and bounds daily. And here, especially on the Mississippi Gulf Coast, some things that we're really proud of. Well, today on the show, we're at Merit Health in Biloxi. We're talking about colorectal cancer. And we're going to talk to a couple of physicians today. First of all, Dr. Brown, how are you, sir?
Nice to meet you, sir.
Nice to meet you now. Dr. Brown is one of only 2 colorectal surgeons in the entire state of Mississippi, and that's fantastic, and they're right here on the Mississippi Gulf Coast. Tell us a little bit about yourself, if you would, first, please.
Well, I was raised in Tampa, Florida. I currently work here on the Gulf Coast. I completed my training in colorectal surgery after a general surgery residency. I completed my colorectal surgery training at Ochsner Medical Center in New Orleans. It's a pleasure to work here on the Gulf Coast, and I think part of our mission here is to raise the awareness of the fact that colorectal cancer is at such a high incidence, especially in this community. And traditionally, many of the patients who have been treated for colorectal cancer on the Gulf Coast have had either to leave the state to go to New Orleans or Mobile in order to be treated for any of their advanced disease. Mm-hmm. And now we have 2 colorectal surgeons here on the Gulf Coast who can provide medical care that we believe is superb. Exactly.
Because a lot of insurances, if you have to go out of the state, they won't cover you.
Exactly. And some of the advanced options that we have for endoscopic surgery, laparoscopic, and even the robot, which you see behind us, is available here at Merit Health Biloxi.
Now, talk about this. I've seen this unit, you know, before, the Da Vinci unit, you know, something that Merit Health is so proud to have.
Well, we have several Da Vinci units here, but this is the Da Vinci XI. It has a lot of advanced features that allow us to approach surgeries that we could not do before as accurately before, especially down in the pelvis. So we use it as a tool in our armamentarium to help treat colon and rectal cancer.
Now, with a unit like this, doctor, you're not actually hands-on, so to speak, right with the patient. You have a remote that you sit at, and you with the cameras and everything, and it just gives you more leeway. I don't want to say leeway, but more finesse.
Yes, sir.
When it comes to doing the surgeries.
Yes, sir. So at the beginning of the case, the patient is brought into the room. Once we dock the robot and have the instruments within the patient, we turn to the Da Vinci unit you see here,
right.
And we perform the case with wristed motions to
That's
complete
amazing.
the procedures. Yep.
It really is amazing. Exactly. You know how far technology has come.
Exactly.
That you can actually do something like that, and you actually have a couple of the units here. But it's amazing. I mean, not only in colorectal surgery, but in all the other different types of surgeries that you can perform with the Da Vinci unit.
Yes, sir.
Now, of course, as I mentioned, there are 2 colorectal surgeons here at Merit Health, the only 2 in the state of Mississippi. Dr. Brown, thank you very much.
It was a pleasure.
I'm going to talk to your cohort, Dr. Tyler, right now.
The robot arms can move far more than my limitations within them.
You know, it's really kind of scary, too, about the rate of deaths in the state of Mississippi for colorectal cancer. Dr. Tyler, nice to meet you, sir.
Nice to meet you as well.
We are number 1 in the state in obesity, diabetes, teenage pregnancy, and I did not know, also colorectal cancer.
Death rate from colorectal cancer, we're the highest in the United States.
Why is that?
I think a fair amount of that is screening and access to care, but I also think a part of it is a lack of access to our specialty in colorectal surgery. Many of our patients can't cross state lines, like you mentioned earlier, talking to Dr. Brown. And so now we're pleased to be able to take care of these patients and keep them here on the coast, closer to their families, and using the latest technology in the process.
And of course, one of the most important things is getting screenings. You know, when you get to a certain age, they say 50. You know, I was 51, the first colonoscopy that I had. And but they say that's an important thing to do. Is there an instance where maybe you might want to get checked out sooner than that, like if it runs in the family?
So we say 50 for what we call an average risk individual, meaning no family history of colon or rectal cancer. But you will see, and I think the guidelines will reflect this soon, we're seeing an increasing incidence in younger patients. Colon starting at 40 and rectal cancer even into the 30s.
Really?
And it's not completely understood now, but I think that will be reflected in the guidelines in the near future to start screening at an earlier age.
Now, colon cancer, it's something that's hereditary?
It can be.
It can be.
15 to 20% of cases are hereditary.
I mean, because people are always saying, for that the cases that are not hereditary, what causes it?
Just a spontaneous gene mutation. So that creates enough to start a polyp, and then more genes mutate over time, and that eventually turns into a cancer over a matter of years.
Yeah.
So many of the times we find these cancers, they've been in there for years, and can be completely prevented with screening colonoscopy.
Now, once you get in there and remove what you do, is there sometimes other treatments that might have to follow, like chemo or radiation?
Colon cancer and rectal cancer are fairly distinct entities, even though they're the same part of the intestine. Rectal cancer, sometimes you need radiation before surgery, followed by surgery, followed by chemotherapy. Traditionally with colon cancer, if the lymph nodes are positive, is when we would consider chemotherapy after surgery.
Now, is there a chance when you find some polyps or something in there that they can go in there, remove it, and that's it? Without having to go through there and follow up with anything else?
Generally speaking, as long as they can safely get the polyp out through the scope, that's safe, and then continue with surveillance. If not, we have access to technology such as this.
I was going to say,
to improve
because
patient
of
recovery.
This, you've got the technology now to get in there and do that real finesse type of work.
Correct.
Whereas it was harder when you didn't have something like this. It didn't say it was impossible, but there's it's more. Again, I love with this thing. I love using the term finesse because that's what it is.
Well, it really is. Laparoscopic surgery. We've been teaching for a long time, and still only 50% of colon surgery in the country is done laparoscopic. 50% is still done open. So with the robot, laparoscopic surgery has rigid instruments, and the robot restores our wristedness like our natural arms, in addition to better 3D visualization over conventional laparoscopy.
And a lot of surgeons are using laparoscopic surgery for a lot of different things. I didn't have the Da Vinci used on me, but I had laparoscopic when I had a hernia repaired.
Correct.
A few years ago. And it's just amazing when, as you said, you might have the whole slit done. With this, no, there's no whole slit to deal with.
Smaller incisions, faster recovery, less risk of infection, and better patient experience.
And of course, a wonderful thing now is the fact that they do have this here at Merit Health in Biloxi, that you're able to offer the people this. They don't have to go to Alabama or Mobile. Mobile is in Alabama, or New Orleans, any place out of the state to get this done.
We love being able to take care of patients on the coast.
Well, we love having you here. We
Thank you
appreciate
guys for
you and
coming
Dr.
today.
Brown. Thank you so much. If you'd like some more information, you can call the number on your screen. Very important. If you get in that age group, you want to go get that colonoscopy done, get it checked out, because got this to help you out, but it's always great to have prevention.
Absolutely.
And avoidance instead of having to undergo that surgery, but at least you know it's here.